Hello, everyone. Welcome to another review class for our practitioners from the Philippines. Okay, so we shall be continuing with our discussion on the tongue diagnosis that indicates spleen yin deficiency. Okay, so we have here a case history. As a small girl, we have Mrs. Z who was repeatedly sexually abused by a relative, and she never fully recovered mentally. To this day, she suffers from depression and mood swings. From ages 16 to 25, our patient suffered from anorexia nervosa. She now eats regularly and has opted for a vegetarian diet. Her bowel movements are regular, stools are soft. She suffers from severe menstrual cramping. She tries to fight her inner tension by jogging. She jogs many hours a day in all weather, even though she feels exhausted. Her face is noticeably yellow. The pale red tongue body, as you can see from the slide, it is quite thin, no? The edges are curled up and the sides of the tongue, you can see numerous cracks here. Her pulse is very wiry and thin. Okay, so the history of the patient's sexual abuse in childhood was the basis for her mental and physical suffering. So this is something that you need to really extract from the patient, and you have to find a way on how to do it, no? Because there are some people there are some patients who may not be very comfortable discussing it. It not only caused liver qi constraint, but also blood stagnation in the chung or penetrating vessel. Okay, so what are responsible for the menstrual pain? So it's definitely qi and blood stasis. The constrained qi, so this was because of the past, no? Led to inner tension and mood swings. And you can see this from the tongue, no? The tongue is curled up on the edge, okay? Curled up tongue edges. And to confirm this diagnosis, the pulse is wiry, so wiry liver. Her chronic starvation for 9 years. Remember, she's now a vegetarian. This injured the postnatal chi. Although she started eating regularly again, the spleen and stomach chi deficiency did not vanish, but manifested as fatigue. So if okay, the spleen chi deficiency failed to adequately transform food into blood, and this condition was exacerbated by her vegetarian diet. The thin tongue body denotes blood deficiency. So as you can see, the tongue body is thin, so payat, no? And this is also apparent in the sides, which are pale, okay? Because deficiency, something that is pale. Due to her excessive jogging, so the chi weakened even more. Exercising contributes to moving the constrained liver chi, and it helps one's mental condition, but this is only for a short time. Here, the excessive exercise and the continuing transverse rebellion of liver chi, as you can see, there's the curling upward of the sides, no? This injured the spleen chi because if you have too much liver chi constraint, this will definitely affect the spleen. Severity of this pathology is reflected in the transverse cracks at the sides of the tongue. So these are the sides. If you look very closely, you can see that the horizontal, the transverse cracks. Weight loss may be due to the exercise, but it may also be associated with spleen yin deficiency. So the cracks appearing at the sides of a tongue that is pale indicates severe spleen chi deficiency. So it will start off as spleen chi deficiency becomes severe, then you will have severe spleen yin deficiency. The patient will always complain of deep exhaustion and fatigue. So it is important that such patients will eat and rest regularly. So don't overwork. Now, if the tongue body is red, there will be symptoms that indicate kidney and spleen yin deficiency. So aside from the dry mouth, lack of taste, emaciation, there may be night sweats and sensations of heat in the body. Okay. Red tongue with transverse cracks on the sides must be taken seriously because it reflects not only injury to kidney yin, but also injury to spleen and stomach yin. So spleen, stomach, kidney. No? Now let's go to our sample cases. So here we have the tongue of a 41-year-old male coming in with sneezing fits, runny nose, exhaustion, intense bouts of hunger, and inability to gain weight. Western diagnosis is allergic rhinitis. Background, excessive consumption of dairy foods. So if you have a patient who comes in with too many allergies, especially like allergic rhinitis, you might want to look into the consumption of dairy products, no? Overwork and emotional problems due to difficult divorce. Okay? I tell you, this really makes sense, no? In fact, you'll be surprised. There are many patients who will come in with some emotional, mental issues. Okay? So the tongue looks pale red. It's actually pink, no? However, if you look closely, um, at the edge on the left, no? It's a little bit red, no? And the tip. Okay, so there's heat in the heart and liver. And the deep cracks on the sides, at the sides, which will indicate severe spleen Qi deficiency that will progress or deteriorate into spleen yin deficiency later on. However, as you can see, the tongue is not yet red. It's just pale red. So it's not safe to say you have yin deficiency here. Okay, so it's long-standing spleen qi deficiency. Next, we have the tongue of a younger patient, 28-year-old female. Symptoms, severe migraines with onset of menstruation. So every time she has her menses, she will have severe migraine attacks. So I feel this is relatively common, no? Okay, shortened menstrual cycle, 23 days with profuse bleeding and intense lower abdominal pain with menstrual bleeding, severe thirst, so think of heat, dry mouth, inner restlessness. Okay, background, irregular lifestyle, alcohol, caffeine abuse, overwork. So here, the tongue, as you can see, is a little reddish and swollen, no? So if it's red, there is heat in the blood. Okay, there's a long vertical crack. Okay. Um, this actually tells us that this patient should not be stressed out too much because they are quite sensitive. Okay, so they get sick easily. And the cracks at the sides, again, would tell us there is long-standing spleen Qi deficiency and onset of spleen yin deficiency because the tongue now looks red, no? And red spots at the sides of the tongue. Okay, sides of the tongue means liver. So there is liver yang rising, okay, or ascending liver yang. Next, we have the 45-year-old male with exhaustion, fatigue, hair loss, tension of neck muscles, headache, soft stools. Diagnosis, chondrosarcoma. So background, the condition followed operation to remove the tumor. So he had the tumor removed. However, he experienced all of the symptoms after. So if you look at the tongue, it's reddish and swollen. Okay. And the coating is without root. So it's rootless coating, especially when you look at the back of the tongue, the root of the tongue. No? So then the cracks at the sides. So there is a lot of heat here, no? So there's onset of stomach and kidney yin deficiency, spleen chi deficiency with accumulation of dampness. Um, observe the shape of the tongue. It's a little bit spherical on the side, no? The bottom. Next, slightly much older patient, 78-year-old female, symptoms, intense pain and twitching of the left leg, insomnia, dizziness, urgency of urination at night, dry mouth, cold hands and feet. So if you are going to observe carefully, there seems to be a contradiction, diba? The mouth is dry and the feet and hands are cold. Okay? So this is like a very complex diagnosis. So Western diagnosis, deafness, irregular heartbeat, background, shock during World War II. The patient was buried under the rubble. Can you imagine the stress there? So this could be PTSD, no? So if you look at the color of the tongue, it's reddish. So reddish means there is yin deficiency, long-standing, spleen Qi and yin deficiency. And there are transverse cracks on the sides here. And then on the anterior third, which represents the lung area, there are also cracks. Okay. So there is lung yin deficiency. And then the tip is curled downward. So if it's curled downward, that is definitely a deficiency heat condition or anti-heat, no? So if the tip of the tongue is curled upward, that's excess heat, heart heat, no? So this one is heat resulting from deficiency in heart yin, okay? And then there is slight yellow coating without root. Okay, so if you look closely at the root, it's a little bit yellow and dry. So there's damp heat in the lower burner. Okay, and if you look at the center of the tongue, it has cracks there. Okay, so there is stomachian deficiency. Now let's go to assessment. If there are no questions, I would like to request Miss Manila. Ma'am
Hi,
Trish.
Doc.
Yeah.
Hi, Doc.
Yes, Miss Paz, good afternoon. I hope you're all
Good
doing
afternoon.
good there. And unlike sa Visayas, no, very tragic. Okay, anyway.
Oh,
But let's finish this before we run out of so sana naman
signal.
Wi-Fi. Because some of our friends cannot join us from the Visayas because
Yeah.
they have no electricity, no signal. So
I hope they're all okay.
I hope, but they have not been responding yet. So I just hope, let's all hope and pray that they're especially sa may Bacolod, northern part of Cebu. Wow.
Cebu.
Anyway, now let's go answer this. Okay, Mom Tricks, the tongue coat reflects the state of which organs, yin organ or yang organ. So every time you look at the coating of the tongue, what does it tell you about? Or why do we look at the coating of the tongue?
It's the state of the young organs.
So
So it
yang,
reflects, yeah,
yeah.
the conditions of heat or cold or excess or deficiency.
Okay, so especially the stomach, no? So another young organ that we have to also consider would be the gallbladder, no? Diba? Usually only one side has coating, no?
Mm.
True or false? The tongue coat reflects hot or cold condition, fullness or deficiency,
True.
and gives an indication of the presence or absence of a pathogenic factor and its strengths.
True.
Yeah. Actually, if you look at the coating, the color of the coating particularly,
Mm.
if it's dry yellow, it is heat.
It's heat.
Hot
Heat.
condition.
It's
No,
white.
moist
Thick
and
and white.
yeah. And
The
also
cold.
you can also
Yes.
see the strength of the pathogenic factor. So the thicker the coating, that means the
This.
problem has been there for quite some time, diba? And I like looking at the tongue first because of all the features of the tongue, this is the first thing that you will see changes, no? So for example, if you have a very thick coating, your goal is uh, to have not a stick coat anymore, no? So you continue doing what you're doing if it is correct because the coating will become thinner. Now, if you start with the patient with no coating, like yin deficiency, so you will aim to have a coating slowly. Okay, so that sounds beautiful. Tongue diagnosis is. Number three, a thin white coat indicates what for the stomach?
White.
Normal. Like the
White coat.
the digestion is good. It's
Because
functioning.
stomach is okay.
It's normal.
A normal coat is thin and white. No, you should be able to see through it. Okay, so if it's thin and white,
Mm.
coating is thin and white. That means the stomach is okay. So it should not be thick. It should not also be absent. Number four, a tongue coat that looks like the coating has been added to the tongue rather than growing out of it. It indicates stomach chi deficiency.
Deficiency.
What is your answer, madam?
No answer.
Actually, this is a weird question. I don't know why.
Yeah, that the
It's
answer
too
is the
big, no?
stomach chi deficiency.
Yeah, because we're trying to make everyone get used to the term rootless.
Rootless. Okay.
Rootless.
So it's a rootless tongue. It's like you just put something there, just like I've seen some places in my
Yeah.
what's this, the top floor ba, yung mga roof.
It's like
It's like a
a
very
frost,
artificial
like a frosting.
oo.
Oh, parang frosting, di
Mm.
ba?
Iba
It's
nilagyan lang ng parang ano, kalam totoong damo, yung pala ano lang. Okay. Rootless. Okay. A rootless tongue coat that is thick. So rootless means may mga kagat-kagat na. So it's no longer rooted. Parang nilagay mo lang siya. No? So a rootless tongue coat that is thick and white on a red body. Take note, the tongue body is red and then the rootless tongue coat is thick and white. What does it
Take a
mean?
minute. Mm.
Stomach chi deficiency.
Mm, okay, if you are going to look like
Thick and
the red
white.
tongue
Thick
body
and
here is
white.
very significant. Red tongue body. So that means there is heat already.
Heat.
And when you look
And
consistency of the coating, the thickness of the coating rather, it's more of
thick
dampness,
and white.
no? More on no, more on
Cold.
phlegm pala, more on phlegm. And it's a little bit rough. And yeah. The answer is
Cold.
if you're sirit na,
Di ba phlegm is yellowish, sticky?
mm,
Mm.
there is heat. Because phlegm can also be white. Can
Oh,
also
phlegm lang. Yeah.
no.
Yeah.
Ah,
Or
yeah, yeah, yeah.
white or yellow.
Yeah, white
Mhm,
or yellow.
phlegm
Thank
lang.
you po. Okay. Now, if
Mm.
you have a greasy tongue coat, what does it mean? Greasy. Mapapansin talaga when you look at the coat.
Uh, food stagnation, phlegm or dampness.
Yes.
Mm.
Three things. Damp turbidity, greasy kasi, di ba? Phlegm. Actually, no. The first thing that you have to look for is the size of the tongue. So if the patient's tongue looks too big, the first thing that
That's
comes to your mind would be phlegm. And then trying to
mhm.
confirm by looking at the surface. It's a little bit rough, no? However,
Mm.
if it's just like it's just
Oh,
really like sticky, no? That's probably damp or damp. And also when you have chronic food retention. A partially absent tongue coat, partially absent, so it's like kulang. What does it mean?
Kulang.
Stomach yin deficiency.
Yes, very good. Partially up.
Nourishment.
So, actually, it should be onset pa lang, no? But this is how it, uh, how do we call it, progresses or deteriorates. So you have a coating, it's rootless, no? So and then eventually nawawaksi-wak na,
Absent.
nawawala na. So that's actually stomach chi deficiency pala yun. However, pag hindi pa rin na-correct siya, it can become stomach yin deficiency. Next, geographic, parang mapa ng Pilipinas, the code, which is red and peeled. What does it indicate?
Use of antibiotics. Stomach yin deficiency.
Yeah. Yes, yin deficiency or
Yeah.
Or exhaustion.
actually pag maraming like if you have more cooling medications like kung meron ka infection, bibigyan ka maraming gamot para mag-cool down. So kumakapal yung coating, no? And it's like tagpi-tagpi. Okay? Especially if you have pneumonia. Okay, so yin deficiency, deficiency in general, no? Kasi nga geographic na, parang geographic like mapa na siya, no? And exhaustion of stomach yin. Number 9, what does a peeled tongue coat indicate? Peeled, ibig sabihin wala na siyang coat.
Um, consumption of stomach chi and yin.
Okay. Um, hmm, okay. This is a little bit this is medyo catchy ito siya because the coating the color of the tongue body was never mentioned. So if it was red, then probably it's already ano, empty heat. So wala pa eh. So your answer should be bordering between stomach chi deficiency,
Yes.
stomach yin exhaustion. Yun lang, no? Or chi and blood deficiency. And we all know that blood deficiency is under yin deficiency is under the realm of blood deficiency. I'm sorry pala, it's the other way around. Blood deficiency is under the realm of yin deficiency. Next, the total absence of a tongue coat indicates total.
Stomach yin deficiency with empty heat. Or kidney yin deficiency with
Hindi
empty
pa, hindi pa red eh. It could be stomach yin deficiency or
deficiency
and
or kidney.
kidney yin deficiency. So it's all
No.
almost always together, the stomach and the kidney. Okay, so much for that. Thank you so much for answering. Congratulations po, Ma'am Trick.